When a person is seriously ill, very frail, or near end of life, it is important to revisit healthcare and end-of-life wishes. They may have changed. At this stage, it is recommended that you update your advance directives and have further conversations with those that matter most. It may be time to consider filling out a MOST form with your medical provider. MOST stands for Medical Orders for Scope of Treatment. It is designed to guide emergency medical personnel and healthcare professionals when providing care for you. It provides a quick overview of your wishes about CPR, level of medical intervention, and artificial nutrition. Section A of the MOST form covers CPR. If your heart were not beating and/or you were not breathing, would you want to have CPR or cardiopulmonary resuscitation? This is firm chest compressions and rescue breaths from another person. Section B has 3 choices of medical intervention level when your heart is still beating and you are breathing. The goal of full treatment is to prolong life by all medically effective means, including breathing tubes and intensive hospital care. The next level is selective treatment, with a goal of treating medical conditions while avoiding things like breathing tubes and intensive care. The last level is comfort-focused treatment, with the goal of maximizing comfort and totally avoiding intensive care and life-sustaining treatment. If CPR is chosen in Section A, full treatment must be given in Section B. In this case, filling out a MOST form is not necessary. Section 3 of the MOST form is a place to choose whether or not you would want a feeding tube, and if so, for how long. It is important that you understand the risks and benefits of all the choices on the MOST form in light of your unique health status. This is why it can only be filled out with the input of a healthcare provider who knows you. The MOST is a set of medical orders to be followed by all medical professionals. It is prepared in collaboration with you or your agent and is signed by your healthcare provider. The MOST form is useful when you prefer some limitations on your care, since in our society, people receive full medical intervention unless they ask for less. If you have a MOST form, it is wise to hang it on your refrigerator because emergency personnel know to look for it there. Copies of MOST forms are valid. It is portable, meaning it can be taken to and honored by different medical settings and providers. You will find a link to the MOST form on the Boulder Community Health Advanced Care Planning webpage. Remember that the MOST form is to be filled out with input from a medical professional that knows you and understands your overall health status.